Hi everyone, I'm Christina Dominguez, and today I am joined by Dr. Kelly Krupa. She is a breast surgical oncologist. Thanks for joining us.
Thank you for having me.
This is October. It is Breast Cancer Awareness Month, a very important month for us to talk about all things related to breast cancer and importance of screenings, etc. And we're particularly focused in this conversation about some of the disparities that women face in the prevention, the treatment, even the outcomes of breast cancer. So let's talk a little bit about the importance of this month. Why are we here having this conversation today?
Well, for one, breast cancer is the most commonly diagnosed cancer among women in the United States, not including skin cancers, and is the second leading cause of cancer death among women in the United States behind lung cancer. The American Cancer Society in the year 2022 predicts that over 287,000 women will be diagnosed with invasive breast cancer, about 2,700 men will be affected, and a little over 51,000 women will be diagnosed with non-invasive breast cancer or ductal carcinoma in situ. So it's common. About 1 in 8 or 13% of women will be affected by breast cancer in their lifetime. And in the last 40 years, we've seen an increase in incidence in non-invasive breast cancer or ductal carcinoma in situ, attributed to early screening, early detection, because ductal carcinoma in situ typically isn't a palpable or tumor that you can feel. And along those lines, since the 1980s, we've seen about a 40% decrease in breast cancer mortality due to screening, early detection, and better treatments for our patients.
That's wonderful. Let's talk about the screenings. When should we start? How often should we do them? And what about women who are at higher risk? It's in the family.
Right, so the importance of screening is that breast cancer is treatable. So we want to find it when it's at an early stage, treatable, and has good outcomes. So for women who are at an average lifetime risk of developing breast cancer, we recommend to start screening with mammograms at the age of 40 and then yearly after. Now, the type of mammogram that you get is also important. So a 3D or tomosynthesis mammogram is what is recommended, which means that there are several images taken of each breast, which gives the radiologist more information and is particularly true in our patients with dense breast tissue. Ideally, around the age of 25, patients are risk stratified for their lifetime risk of breast cancer with their primary care doctor or gynecologist, so reviewing their family history and their personal history, because our high-risk patients are typically recommended to start screening before the age of 40 and may even be offered supplemental imaging such as a breast ultrasound or MRI.
You mentioned dense breasts.
Yes.
A lot of women will get that after their mammogram. They'll get a letter or
Sure.
that information. What does that mean, and what should we be doing about that if that's the case?
So there are 4 different types of breast tissue, and how we define dense breast tissue is sort of the ratio of the fatty parts of the breast to the other glandular elements. So patients who have dense breasts, that tissue is going to show up as white on a mammogram. Well, tumors also show up as white on a mammogram. So again, getting the tomosynthesis imaging, we have more information and can kind of see the tissue at different levels. And so those patients may not only be offered tomosynthesis as a standard, but maybe even a breast ultrasound to better examine their breast tissue.
Okay. And we said we were going to be talking a little bit today about disparities. What are some of the disparities that exist in perhaps the screening or the treatment of breast cancer for women?
Sure. So unfortunately, cancer health disparities exist, and health disparities refers to a difference in outcomes related to race and socioeconomic status. So ideally, we would define populations by biology and not race, because race is a socio-political categorization. But in the United States, data is largely reported by race and ethnicity, and we know that race is correlated with social determinants and health outcomes. Social determinants of health refers to a patient's living and working conditions that impact health outcomes and health equity. So some may even argue that your zip code is more important than your genetic code. That where you live impacts your treatment, screening, overall mortality. And studies have looked at patients who live in a neighborhood with a low socioeconomic status are more likely to present with stage 3 or later breast cancer compared to a more affluent neighborhood. You can think of social determinants of health as the non-medical factors that influence health outcomes.
So let's talk about some of the disparities. For example, women of color, you're seeing more incidents of breast cancer. Talk about why and how that works.
Sure. So in general, breast cancer research has found that Black and Hispanic women are more likely to present with breast cancer at a younger age, so that's under the age of 45, and Black women have a 40% higher mortality rate. We also know that there's different subtypes of breast cancer. Hormone receptor positive breast cancer is the most common type among all races and ethnicities, and that means that the tumor is fed by hormones in the body. Hormones are kind of like a fertilizer for it to grow. Whereas more aggressive subtypes, such as triple negative breast cancer, they're not using hormones to grow, and we see that type of aggressive breast cancer in about 2 times the rate in Black women. Why there is a gap in outcomes in Black women is likely multifactorial. So statistically speaking, Black women are more likely to have heart disease, diabetes, obesity, less likely to breastfeed following childbirth, which are risk factors for breast cancer. Black women are also less likely to have adequate health insurance and less likely to have access to a primary care doctor, and are less likely to have screening at an accredited radiation facility or radiology facility, which will impact screening, treatment, and overall outcomes. And as I kind of alluded to, the subtype or biology of a tumor is important in breast cancer. It's important in how that tumor may respond to treatments that we have available. So ongoing research to understand why Black women are disproportionately affected by triple negative breast cancer is really important.
And also, what are healthcare providers doing to make sure that we're sort of getting to that population and making them aware of their risks?
Sure. So one thing that we are doing is in the realm of screening. So raising screening awareness and education and bringing screening opportunities to communities. Another is when a patient is in their doctor's office and they have a diagnosis of breast cancer, screening for any barriers that they may have to treatment. And actually in our electronic medical record, we can screen for social determinants of health under our social history. And social workers and patient navigators are largely integral in helping patients determine what barriers they may have to treatment and how to overcome those. On a larger scale, breast cancer research, placing health equity in our agenda and involving patients as advocates is really important. And as I mentioned, continuing to try to understand triple negative breast cancer, why it disproportionately affects Black women is ongoing and very important. At Rochester General Hospital, we also offer intraoperative radiation therapy, which means that a patient has a one-time dose of radiation in the operating room, which eliminates a traditional course of radiation, which could be daily over 3 to 5 weeks. So for patients who are a candidate for intraoperative radiation, this is a really great way to break down barriers of transportation or access to facilities.
It's so important. You're looking at the whole patient,
Right,
just
exactly.
beyond the medicine, right?
Exactly.
So again, we're talking about Breast Cancer Awareness Month. I'm here with Dr. Kelly Krupa. She is a breast surgery oncologist, and we're talking about some of the disparities that you see in treating people. And you talk a little bit about prevention. Would you say screening is really your number one?
Right, screening is very important. So again, at the age of 40, if you have an average lifetime risk of breast cancer is when you should start. There's also a few other things that you can do to reduce your risk. One is maintaining an ideal body weight. Another is limiting or eliminating alcohol intake. And the last is exercise. About 150 minutes a week of exercise is recommended. And we know that exercise can actually reduce the risk of breast cancer recurrence in patients who have previously had breast cancer.
Do you think a lot of women know about that? Because I don't know that they always make the connection between cancer and exercise, really.
Yeah, it's very interesting, and this risk reduction has to do with lowering estrogen levels. So studies have shown that exercise reduces estrogen levels, and this is particularly important in our postmenopausal women.
Anything else that you want to share about what women should keep in mind this month, maybe having a conversation with a girlfriend, a family member, a daughter about the importance of this month and what we're talking about here.
Sure, I think that if you have any questions about your own personal history or family history, such as should I start screening earlier, do I need genetic testing, start that conversation with your primary care doctor or any doctor that you're seeing, and they can point you in the right direction. Another key component of breast health is breast self-awareness, so knowing what's normal for you. Say you're getting out of the shower, you're toweling off, you notice that something looks different or you feel something new, that you let your doctor know about that.
Let's just talk a little bit about, you mentioned some of the things that you do in your office and as a system here at Rochester Regional Health, how we're trying to help raise awareness about some of the dangers of breast cancer, of course, and of course the resources that are available to women.
Sure, so one really great resource is Rochester Regional Health Mobile Mammography, which brings mammograms to communities. Another wonderful resource is the Breast Cancer Coalition of Rochester, which not only has resources and networking for patients, but also is involved in advocacy at all levels. Embrace Your Sisters is another wonderful organization that provides financial support for patients during breast cancer treatment. The American Cancer Society also has a local program called Road to Recovery, which consists of volunteers who provide transportation for patients to and from treatments and appointments.
A lot of great resources.
Right.
Thank you so much.
Sure,
thank you for the work that you do here.
you.
Keep women safe. Well, we talked about a lot of information here today. We have resources for you that you can access all online. It's rochesterregional.org/breast. You can also call 585-922 4715 to find out more information and get a lot of the details about some of the topics that we talked about here today. Thanks for watching.